Chapter 19, Part 2, page 394. Where does inventory come from? Every healthcare facility has hundreds and oftentimes thousands of items in its inventory. Each item serves a specific purpose. Some inventory items are used regularly, such as detergents for decontamination area. Others, like certain specialty catheters, are used less often, but most always be available when needed. Unavailability of certain items may compromise patient safety by delaying treatment or care. All of these items represent a financial investment and must be managed properly to keep costs down. Managing inventory is one of the primary responsibilities of Materials Management Department. The difference between material and materials, defined on the bottom of page 394. Material or material. The words material with an AL and material with an EL are often interchanged. However, they do have different meanings. Material, when used as a noun, refers to the elements, substances, or parts that comprise something. For example, building materials, bricks, lumber, nails, carpet, things that make clothing. Material, with an E, when used as a noun, refers to supplies or equipment that an organization uses in any operation or business, like batches of pens, instruments, surgical instruments. The Materials Management Department is responsible for the purchase and receipt and delivery of items to the user department. It oversees the flow of supplies and equipment coming into the healthcare facility. Buyers in the Materials Management Department search for and purchase items using a variety of tools and strategies to ensure they are able to meet the facility's needs at the lowest possible cost. Most health systems belong to purchasing groups that enable them to purchase items at pre-negotiated discount pricing. These group purchasing organizations, GPOs, represent many healthcare facilities. GPOs are able to negotiate contracts for products and services that enable facilities, members of the GPOs, to receive special reduced pricing. Materials management plays an important role in the supply chain by helping ensure that everything necessary to support patient care is available when needed. Once items are received at the healthcare facility, they are checked in to verify that what was ordered was received. From there, items are placed into storage. In most facilities, a large portion of inventory items are stored in the materials department. Then, items are delivered to various areas as needed. Figure 19.3 reviews the 4 steps in the flow of materials through the healthcare facility. Handling commercially sterilized items. When commercially sterilized items are brought into the healthcare facility, care must be taken to ensure that those items are not compromised during storage, handling, and distribution. That means that those items must be stored in a manner that will protect each package from events that may render it unsterile. Chapter 16 identified requirements for sterile storage. It is important to note that those same requirements apply to all sterile packages. Although the types of packaging may differ in appearance and feel, commercially sterilized packages are vulnerable to the same potential contaminants as in-house sterilized items. Items should be stored in a clean area, away from moisture, dust, and other contaminants that can compromise packaging. Dust on the outside of a package can be easily transferred into operating room and or introduced into the clean environment, possibly contaminating it. As with every sterilized package, care must be taken to ensure that the integrity of the package is maintained until used. CS technicians must understand storage and handling requirements, and they must be able to understand the basic information provided on each commercially sterilized package. Commercially sterilized package information. Unlike in-house sterilized items, commercially sterilized packages come with printed instructions that contain pertinent information for CS technicians. Most product packaging contains information regarding product manufacturer, sterility, storage, and safe use. Figure 19.4 on the other page, 395, important information provided on package labels, explains by category, type of information, and why it is important in this chart. Figure 19.4 reviews the types of information commonly found on commercially sterilized packages and labels and explains why that information is important to CSs. I'm going to read this chart to you. It's separated into 3 categories. The first one is category. The second one is type of information. And then why it is important is the third column. Important information provided on package labels. There's different types. There's manufacturing information on a package label, sterility information on a package label, storage information on a package label, and safe use instructions, how to use it, the item. I'm going to read you the category, then the type of information, and then why it is important from left to right. Manufacturer information, first box in the first column. Type of information, second box in the middle column. 1, manufacturer's name. 2, product name and specifics, size, etc. 3, product reference number. 4, date of manufacturer. 5, batch or lot number. 6, product serial number. And 7, expiration information. And why is that important? Third box in the top row. Numbers 1 through 3 are important for reordering purposes and verifying that the correct product is being dispensed. And 4 through 7, numbers 4 through 7 for manufacturer information, are important for tracking product to the patient, product recalls, and stock rotation. Sterility information. Type of information. 1, sterility statement, and 2, expiration date. In the third box, why is it important? Number 1, important for determining if a product was supplied sterile, and 2, important for determining the shelf life of the product. Number 3, storage information. In the second box, number 1, what type of information? Storage temperature limits, moisture or humidity limits, and 3, fragility. Why is it important? Numbers 1 through 3, important for ensuring that the items are stored as required by the manufacturer. And finally, the last one, safe use of instructions in the first column. Second column, type of information. Number 1, identification of single-use item. 2, notification of latex contents. And number 3, references to product instructions for use. Why is it important? Number 1, important for ensuring single-use items are not processed. And numbers 2 and 3 are important for providing patient safety information. Manufacturers, back on page 396, manufacturers employ several symbols to convey information on package labels. Those symbols are designed to provide information that is easily understandable in the usually small space of a product label. In figure 19.5 on page 396 provides a review of common commercially sterilized symbols and their meanings. Please review those in 19.5. Expiration dates, page 397. Many medical products on the market today have expiration dates, and these are very important for CS technicians. It is important to note that even a healthcare facility uses an event-related shelf life policy, expiration dates on medical products must be checked, and items that have reached the end of their stated shelf life must not be used. Identifying expiration dates can be difficult because there is no standard requirement for where they are placed on the package. For that reason, CS technicians must be diligent when checking packages for expiration date. When new products that have expiration dates are received, all staff handling the packages should be educated on the existence and location of the expiration information. See figure 19.6 for different locations of expiration dates on packages. In 19.6, it provides examples of locations of expiration date information on commercially sterilized packages. Not all packages have an expiration date. Some products use an event-related shelf life system. Those packages will have a statement indicating that the package is sterile unless opened or damaged. In a storage area filled with commercially sterilized items, there will most likely be a combination of items with expiration dates and items with event-related sterility statements. It is important to know which items have expiration dates and to check those dates each time a package is dispensed. Inspection. Regardless of whether an item uses an event-related or date-related shelf life, it must be inspected before being dispensed. That inspection is part of a multi-check safeguard. While it is true that the package will be inspected at the point of use, CS can reduce delays by identifying package integrity issues before they reach the point of use. Inspection should include a visual check to ensure that the packaging has no holes, tears, signs of moisture, or other visible damage. Packages that show excessive handling, wear, should also be identified. Expiration dates, if present, should be checked. Figure 19.7 shows a CS technician checking a package before dispensing it. Items locator system. Every healthcare facility has hundreds and perhaps thousands of medical supplies. Each one can impact patient safety if it cannot be located when needed. Poorly organized storage can also lead to loss or damage, which can impact the facility's budget. Every medical supply storage system must have a system in place that enables all employees who handle supplies to locate a specific product quickly. Systems usually use an alphanumeric or alphanumeric system. An alphanumeric or alphanumeric combination system to enable employees to easily locate supplies. Page 398, loss of sterile items. Ideally, disposable items are purchased, used, and replaced. However, there are times when a disposable item may fall out of the sequence. When that happens, the item is lost, which may delay patient care and treatment and cost the facility money for replacement. Figure 19.8 lists some common causes for the loss of sterile items. (19.8) is common causes of waste and loss. Each of the above examples in that chart represents a financial loss to the healthcare facility. I'll read the chart to you. It's 2 columns. Expiration, the item was not used before the end of its designated shelf life. and therefore it's a loss. Contamination, the item suffered an event that rendered it unusable, and it's a loss. Obsolescence, meaning it's worthless for use. The item was replaced by a newer, different item. The old item is a loss. Lost or loss, the item was lost and cannot be located. And theft, the item was taken by an unauthorized individual, and it's lost. And it's a loss for the company. Transport of commercially sterilized packages. Equipment such as carts and totes used to transport devices or supplies must be frequently cleaned. Items that are to be transported outside the facility must be contained in an appropriate containment device as they are transported. These transport devices must be cleaned routinely to ensure that bioburden is removed. Care should be taken to protect packages from contamination during transport. Items should not be exposed to conditions that may compromise the sterility of the package, such as excessive temperatures, humidity, or moisture. Distribution of supplies. Distribution involves moving supplies throughout the facility, generally from their storage location to point of use. In most facilities, this activity includes distributing consumable supplies from the storeroom, or CS, to clinical units, including the OR. The goal of distribution is to move the correct items in appropriate quantities to the right places at the right times and in the most cost-effective manner possible. The method of supply distribution used will vary depending on frequency and or volume of use. Peak activity times, the amount of storage space available in the areas to which the supplies are distributed, and other factors. For that reason, it is important to note that no single distribution method is the best choice for all facilities. Each healthcare facility will need to assess its particular needs and develop a system that will best suit those needs. In most cases, many different methods of distribution will be used to meet the needs of the different departments. Definition: distribution. The movement of supplies, primarily consumable supplies, from the storeroom to clinical units, and processed supplies from central service to the operating room throughout the facility. Inventory, replenishment, and distribution systems. The methods used to replenish needed consumable supplies throughout the healthcare facility must be carefully considered and planned to best manage costs, to have items available when needed, and to minimize the supply efforts of responsible staff members. Effective systems are, to the extent possible, automatic, little or no intervention by the user or user department if necessary to reorder. The following are examples of inventory, replenishment, and distribution systems commonly used in healthcare facilities. Periodic automated replenishment system. The periodic automated replenishment system, or PAR, systems establish a standard level for each item stored in a specific department. This level is usually jointly determined by the user department and material management staff. After these levels are set, there is typically no need for items to be reordered by clinicians. Instead, CS and material management personnel inventory or count each area that houses this inventory. They check the current on-hand supply and note the quantity of each item still available. The amount needed to bring the quantity of supplies to the agreed upon standard, PAR level, is determined and automatically transmitted to the material management department or vendor, who will send the required supplies. Figure 19.10 shows the checking and restocking of PAR levels on a shelf. Definition: periodic automatic replenishment, often called PAR level or PAR system, an inventory replenishment system in which the desired amount of products that should be on hand is established and inventory replenishment returns to the quantity of products to this level. End of chapter 19, part 2.